This is the Fredericksburg Neighbors Podcast, the place where local businesses and neighbors come together. Here's your host, Dory Stewart.
Welcome back to another episode of the FXBG Neighbors Podcast, where we share the stories of our favorite local brands. Joining me today, I've got Dr. TaLisa Taylor. She is with Tailored for You Health and Wellness. Dr. Taylor, welcome to the podcast.
Thank you so much for having me.
Thank you for joining me. I'm excited for this. I'm excited to get to know you better and learn more about your business. So let's start there. Share with us a little bit about Tailored for You Health and Wellness.
Awesome. So, Tailor for You Health and Wellness is a physical therapy practice, but we aren't like your traditional PT practice. We actually have that specialization in women's health. So, that basically just means that I treat the female or the woman through the entire lifespan, whether it's from adolescence all the way up to when we mature in life and we start to establish needing a little bit more care as it relates to perimenopause or menopausal changes when we get to that point in life.
Amazing. So I didn't even know that this was a thing. This is fantastic. So you are physical therapy specializing in women for all different stages of life.
Absolutely. So basically,
Wow.
title is called pelvic health physical therapy. In some contexts, you'll find pelvic floor physical therapy. That's usually the more popular context. But it basically just means that, hey, if you have any type of women's health related issue or concern, you can be seen by a pelvic floor therapist for it. So for an example, some of the things that I usually treat in office is I support women during their pregnancy, whether they are having any type of pelvic related pain or pregnancy related pain, like the typical, my pelvis hurts, my back hurts because I have a baby or babies pressing onto my pelvis. So I usually see women during pregnancy for that. Or sometimes they just come in during that pregnancy phase where they just want to learn a little bit more or be educated on how to perform the propping pushing techniques. Or, hey, my goal is to have a vaginal delivery. How do I learn how to breathe correctly? So we can also support them in that birth preparation phase too. The typical things that are very common that I see is the urinary incontinence. So I sneeze, I cough, I laugh, I try to lift weights, I try to run behind my children, and I get that expel of urine, whether it's just a couple of dribbles or sometimes it's so much I have to change my clothing. We also see women again in that perimenopause, menopausal phase of life, whereas sometimes, we're just like, hey, we're getting older. This is just something that's going to happen. We don't really understand that there's a lot of support because there are a lot of tissue and vaginal changes that come with perimenopause and menopause, and pelvic floor therapy can definitely help you with that, whether it be pain with intimacy or you're finding that, hey, I'm still trying to establish a good workout routine and I'm finding that I'm having joint pain with that. So just like I said in the opening, we're just supporting all women from the adolescence phase up to that perimenopause and menopause phase of life. So everywhere in between, you can have support in pelvic floor therapy.
This is so interesting. And I imagine there are a lot of women that don't even know that this is a resource available to them.
Yes, absolutely. And I think
Wow.
the most misconceptions that we find, especially just as women in general, is a lot of times when we get those symptoms or we start to develop those episodes of urinary leakage, for example, we think that, hey, that's my ode to motherhood. I've had a baby. This is like supposed to happen because my aunt said it happened for her or my mother said it happened to her. So that's the way that I get tapped into motherhood. I've had a baby. I leak a little bit. This is normal, right? And I usually always say, yes, some of these symptoms are common. Myself, maybe the next woman, maybe your aunt, your mom could have established some of these same signs and symptoms, but it's not normal. So please know that, yes, some of these things do happen. They are normal occurrences as it, happens for us as far as women's health, but it's not one of those things that we have to just deal with.
I am so glad you talked about that because I do think that there are so many women who just think, yeah, just a part of giving birth, part of being a mom. It's just something we have to deal with as women. And so to know that it's not something that we just have to deal with as
Absolutely.
women, I'm really glad that you talked about
Yes, you do not have to stay pee in your pants. It's
that.
just like, again, I just had a baby, so I
Mhm.
guess I'll just carry this for the rest of my life. No, there is
Right.
support and there's education out there.
I love this. So, this seems like such a niche specialty. I'd love to learn about your background. How did you get into this?
Oh my goodness. So, my testimony when it comes to me diving into pelvic floor therapy, I always tell people pelvic health PT actually found me. I was
Oh,
not looking for it. I was about a year out of physical therapy school as a new grad, and the company that I worked for at the time, we had a female called the office that was looking for support from a female physical therapist. And she just pretty much explained to me that, she had just had a baby and she was just having like some difficulty with like stability in her pelvis. And then she came in. So I was able to treat her. But the funny thing was, I had none of this background knowledge like I had now. So just seeing how she progressed from like literally having a newborn to we only had a couple of weeks for me to establish a plan of care for her before she had to return back to work from maternity leave. By the time we ended her plan of care for physical therapy, I had that thought of, I think women's health may be an interest of mine. So I decided to take a level one course, which the level one course basically just entail that you're in a specific place for a weekend. It's like yourself and other physical therapists, occupational therapists, some medical doctors also take these classes too, from basically just like around the world. And you spend a weekend like learning the pelvic floor, the ins and outs, how to do an external genitalia assessment. We also learn in level one classes how to do an internal pelvic exam too. So those are things that I've learned in classes with my continuing education that I also translate into my daily practice with my clients as well. Just being able to provide that support to say, hey, if you give me your verbal consent to do an internal exam, I found that these pelvic floor muscles on this side of the pelvic floor respond like XYZ. So we're not guesstimating on like what stretches and exercises that we can give you. Those exams really give us that opportunity to pinpoint what will resonate and be tailored best for you.
amazing. Interesting. Interesting. So, talk to me a little bit about the business side of things. How are people finding you? Are you working directly with doctors to get referrals or share a little bit about that process?
Yeah, so me personally, I feel as though my practice is known more from like community outreach.
Ah,
One of the things that I do is I like to partner with different businesses that I know will serve my typical client. So I
mhm,
go to the places like Club Pilates or Pure Bar or Burn Boot Camp, and I offer to do in-person workshops at these facilities so I could, one, use that as an opportunity to connect with the community in their space, but also just knowing statistically that there are 1 in 3 women that have some form of pelvic floor dysfunction. So if there are 9 people that are present during one of my workshops, I'm knowing at least 3 of them may
mhm.
have some form of pelvic floor dysfunction. So I just use that as a way to, one, just educate, and then find ways again to just connect to the community, and it pretty much just goes from there. So a lot of my referral sources are from local chiropractors in the area. I'm connected with like a myofunctional doctor that works on a lot of oral release stuff.
Mhm.
So she refers to me. I have some OB-GYNs in my network as well. But if I'm being completely honest with you, the Facebook moms groups
Mhm.
business.
That's where it's at.
It may be women that I have supported before. So if someone is like, hey, I'm, experiencing XYZ, who do I go to? Do you have a pelvic floor therapist in mind? They
Mhm.
usually just like hype me up and highlight my
Right.
business.
I love that. Yes, that makes complete sense. You are so smart. Networking and collaborating is
Ab-
really powerful.
Absolutely.
I love that. So, what is something that you wish the listeners knew about your business?
Ooh, that the support is here.
Mhm.
I oftentimes am told that I've dealt with this for so long, or maybe I brought this up to my doctor multiple times and I didn't know where to go. And then I decided to ask in a Facebook moms group, or I decided to just take it upon myself to advocate for myself and look on Google. I think the biggest thing that I would want for people to know that, again, you don't have to live with a lot of these signs, symptoms, and conditions and pelvic health concerns. Again, like we stated before, yes, a lot of this stuff does come about with typical aging, right? Or it comes about when you've had children, whether you've had a vaginal delivery or a cesarean delivery. I just want people to know that, hey, the support is out here and we're right here in your community looking to advocate for you, educate you, and guide you along your journey.
Amazing, amazing. And if the listeners want to connect with you, if they want to learn more from you, where can they find you?
Absolutely. So I am a social media girl. All of my social media handles are Taylor, Taylord, the number 4, the word you, underscore heal well. And that is across Facebook, Instagram, and TikTok. I love the social media aspect of things because if we're being completely honest, that's pretty much where people are gravitating to these days. If I
Mhm.
wanted to find a quick recipe, sometimes I go to TikTok or I go to Pinterest. If I'm looking how to learn how to do something, sometimes I go over to YouTube. So I'm starting to do a lot in the social media space because a lot of times that's people's first go-to as far as like searching for what it is that they're looking for, or if they're looking up any type of symptoms that they have, they're starting to go to social media first. So social media is definitely where you can find me. And I'm quite funny too, might I add.
I can see that. I can see that. Well, I will definitely start following you. And for all the women listening, follow Dr. Taylor. Thank you so much for being my guest today and sharing your wisdom with us.
Thank you so much for having me.
Thank you for listening to the Fredericksburg Neighbors Podcast. To nominate your favorite local businesses to be featured on the show, go to fxbgneighborspodcast.com.